All right. Can everybody on the line hear me?
Yes.
Yes.
Okay. Well, good morning. We are trying something a little bit new and appreciate all of the folks who've come to help us do that. Good morning. I'm Ruth Ann Norton. I'm the chair of the Governor's Lead Poisoning Prevention Commission. We are broadcasting from Henderson Hopkins Elementary School. I wanted to just have a moment to have the most wonderful principal in the United States say a little bit of a welcome to the commission. He's going to have to come up here, I think, to be seen. But as Peter will tell you in a minute, Derek the dinosaur today greeted all of the students to bring attention to lead poisoning prevention awareness and Children's Environmental Health Month. So Peter, thank you for having us.
I think it's wonderful that you all have come. So thank you, Ruth Ann, for that wonderful introduction. Yes, Derek Dinosaur was a huge hit today. Right now, he's touring the kindergarten and pre-K classrooms, emphasizing how to be healthy with his great coloring book. And we're here in East Baltimore. Henderson Hopkins is a pre-K 8 school servicing 700 students in East Baltimore. And Ruth Ann and I talked about how this is in the footprint of lead paint and lead paint poisoning, and how important it is that we address this issue so our students are healthy. I just tell one quick story. I've been in education for 30 years. When I was a first-year teacher, one of my students, Greg Jones, I remember him to today, the most wonderful, beautiful child. And when I was teaching him, he was in 8th grade, he was at the 1st grade cognitive level. And when I went into his IEP and understood what the issue was, he had severe, severe lead paint poisoning. This impacts our students, and it's an issue that can be addressed and should be addressed. And I'm just really happy that you're here in East Baltimore, where this is a chronic issue, to help us address it. So welcome, and have a wonderful meeting.
Thank you, Peter. Thank you very much. All right, Wendy, we're going to try to get started here.
Yeah.
If you don't mind pulling up the agenda on the screen, and we'll run mostly off of the agenda. I know a number of commissioners are here, and I want to just have people introduce themselves. And I'd like to start with the folks who have come into the room and joined us. So if you're a commissioner who's at the table, would you please introduce yourself, and then we'll go to those online. Might as well, we'll start with you.
I am Angela Paul. I'm Assistant for the State Department of Education.
Can you all hear Mangela?
No, not really.
Okay. Hold on.
Thank you, Dr. Mitchell. You're so good all the time. Hey, good morning. And I'm Angela Paul. I'm from the Office of Child Care, Maryland State Department of Education. Welcome. Thank you.
Good morning, Camille Burke, Director of the Childhood Lead Poisoning Prevention Program, Baltimore City Health Department.
I'm Barbara Moore. I'm a pediatric nurse practitioner, commission member. I'm from Mount Washington Pediatric Hospital.
Hi, I'm Paula Montgomery from Maryland Department of the Environment, Lead Commission member. Thank you for everybody that came.
I'm Clifford Mitchell, Maryland Department of Health Commission member.
I'm Kaylee Wallington with Maryland Department of the Environment.
Okay, can we have folks online introduce yourself, please? Can you hear us, Wendy? No? How did
Hi,
that?
this is Eamon
Oh,
Flynn from
sorry,
the Deeds.
Anna. Anna, you want to go ahead and start? I see that you're muted, but I do see you're online. Can you start us off, Anna? No, I see her. She's there, but she's still muted. Who else? Christina, are you there?
I am Christina Push, Executive Director of the Maryland State Child Care Association. Thanks for having me, Commissioner, on the group.
Let's see who else is here.
Good morning. My name is Benita Cooper with the Maryland Insurance Administration.
Fantastic. I think Anna has joined us.
I'm having a little connectivity problems. I'm Anna Davis, commission member.
So are we having connectivity problems? You know, a good idea, but not quite perfected yet. Wendy, do we have other commissioner members on the line?
Yeah, I'm looking. Benita.
Yeah.
Oh, Susan, there you are, Susan. You're muted.
Good morning, Susan.
morning.
So glad to have you.
Thank you. Good morning. Sue Kleinhammer, Lead Tech Services Commission member.
Great.
You don't see anybody else.
Okay, I see that we are joined by the
Oh,
secretary.
Paul Rogers.
Thank
Sorry,
you, Mr.
Paul
Secretary,
Rogers.
for joining us this morning.
Hi, Commissioner Eastern Shore.
Oh, I'm sorry about that, Paul. Horacio, do you want to introduce yourself?
Yeah, good morning, everyone. This is HT Horacio Tablada. I'm the Secretary of the Environment. But for many, many years, I've been fighting alongside many of you on the eradicating child lead poisoning. And this has been more than 20 years at least. So this has been a passion of mine, even when I was in the different positions at MDE. So I just wanted to take advantage today that I have some time to see what's happening and get my, I know that my staff there, and from Wendy and Kaylee and Paula and Dr. Banks and all those who are there. I mean, we're well represented at MDE, and but I always like to hear, from the commissions that are part. MDE is part of it. So I thank everybody for joining this morning.
We are so glad to have you. We're going to try to avoid too much of the echo. I'm not sure how we're going to do that. But I would like to move for the approval of minutes. Do we have a motion? We have a motion by Commissioner Montgomery, a second.
I second.
A second by Commissioner Moore. All in favor?
Aye.
All opposed?
Aye.
Ayes have it. So just as we get into the commission agenda here, a reminder that next month in November, MSDE, OCC will provide an update. Thank you, Angela. And we will have a health department open forum with the case managers. Cliff, would you like to say just a brief on that?
So what we will do is have several local health department case managers who will be here to discuss some of the issues and challenges that they are confronting as they implement both the new 3.5 microgram per deciliter state notification level and the ongoing challenges and opportunities for working with stakeholders to improve outcomes for children with lead poisoning. I anticipate that we'll have several local health departments here from across the state, both small and large, and geographically distributed, and we will probably have some additional announcements and opportunities to share some of the experiences of the local health departments both in implementing the new home visiting programs in 11 jurisdictions, plus statewide, their experiences with abatement, primary prevention, and effective case management.
We look forward to that, and I know Camille will be helping with that, and others for sure, and Dr. Rogers. So we are going to move to some what is said as old business, but I think it's new business. Every year, the commission puts out its annual awards and recognition for work about in the community on lead poisoning prevention, and honors people who have put their life's work into protecting our children. I am so proud today that we are able to present 3 awards. Wendy, if you would, you want to, I guess the first one up, and he's out of the room, so let's go to the next one. Barbara, it is our pleasure, our honor to present you with the certificate. I think Wendy has the certificate, so we'll have to have another ceremony in doing that. But what an honor to serve with you and to see you in action on all that you do for the children of Baltimore and the state, and your dedication to go beyond the clinic to ensure that children have safe housing. There is no better advocate. I am forever indebted to nurses because they saved my life at the age of 13. And I think that nurses rock, right, in general, but I've never met a more dedicated public servant than you. And I think we all stand in honor of you. Would you like to say something? Somebody want to? There you go. And sorry for the awkward circumstance.
Completely surprised. Thank you, everyone. It's been my honor to serve on this commission for 20 years and be able to be a voice for not only the families that we serve in clinic, but to go beyond that and work with the counties and the city to make it known throughout the state that this is a problem, not only in one little geographic area, but throughout. And that it's a passion of mine that it has kept me going for many, many years. So thank you all. You're welcome.
And Wendy, I don't know if the secretary is still online, but who do we have next? And if he wants to present.
Sure, I'd be honored to present the next one. And congratulations, Barbara. Well, our next recognition goes to Wendy Phillips, our very own Wendy Phillips. The work of someone like Wendy that keeps the commission glued together and keeps the agendas together, keeps the minutes, keeps the mailings back and forth, and that's such a critical role in communication, especially these days where a lot of us work remotely or distant from the offices. And so, Wendy, I would like to thank you on behalf of the department and the Lead Poisoning Prevention Commission for the work that you've been doing. And over the years, many people have done your role, including my very own Tracy Smith, who is recuperating right now. But I know that the kind of work that goes in there and the dedication from you is recognized and appreciated. Thank you. Yes, applaud.
Yes, thank
you,
you,
Mr. Secretary. I
Thank you all very
appreciate
much.
that. And Wendy, so well deserved on behalf of the commission. We couldn't do this without you. And I'm sitting beside Paula Montgomery, who is saying the same thing, of course.
Woohoo!
There you go. And I think we have a third award. Wendy. So you want to turn your volume down for a second? There you go. So the best part of this award is that everybody now knows that Wes Stewart's real name is George. I know Wes from when he joined freshly out of law school, who gave up a law career to represent families in community, and was the tireless guy driving an old beater car, always wore a white shirt and a tie, and people didn't know if he was going to come up and try to save them or he was going to be their lawyer. They weren't sure why he was knocking at the door, but he made more friends and helped more families when we were trying to build faith in the work that we were going to do to prevent lead poisoning. And for the last 26 years has endeavored to continue on this fight in childhood lead poisoning, to create healthier housing. And for those of us who have the privilege and honor to work with Wes, we know that he is literally tireless in his efforts. So it's our pleasure and honor to recognize my friend and colleague, Wes Stewart. Oh, Wes is going to say something. Hang on.
Thank you very much from all of you. I really, get inspiration from Ruth Ann, has been a relentless and passionate advocate to end lead poisoning. I have terrific colleagues from Green and Healthy Homes, but also just all the state agencies, MD, MDH, DACD, have always been consistently there. Our city agencies, our community partners. So it's been a collaborative effort. And the fact that we have a 99% reduction, but we're not satisfied is what is really great about this group, that we haven't achieved our goal. We don't pat ourselves on the back, we keep going. So, but also across the state, it's really about our families that we serve, and Hagerstown, Cumberland, Salisbury, Baltimore, Prince George's County, it affects so many. So I appreciate the award, but thank you all for being partners in this mission. So.
Okay, so Wendy, thank you and congratulations to these well-deserved awards. Wendy, we did a little bit of a survey on what people saw as important objectives that they would like to achieve over the next year. Do you have that? Can you bring that up on the slide?
Yep, here it's coming.
Okay, let's see what we have here. Thank you to everybody who participated in weighing in. And I think big efforts here, we want to focus on data for sure, and how we reach targeted populations and move to 3.5 responsibly, effectively, finding new funding, and making sure that we're reaching all of the folks in the state. But I didn't know, and I appreciate everyone who has weighed in. We are going to be taking input from the public as well in how we ought to arrange our work, continuing out this year and going into a new administration. We will have a new governor next year. Whoever wins the election, we will certainly share these objectives with them as well as part of our advice to the secretary and to the new governor in transition. But I wanted to open this up to anybody on the commission who may have comment. Paula, I know you contributed to this and others on the line here. But do you want to say anything about seeing that you're inside the agency, but working so much outside the agency? I'd love to get some feedback from your objectives for the commission.
So one of the things that we all know COVID-19 has severely impacted is not only getting our children into clinics, but also getting into the homes of families. There is a reluctance, in addition to all the other factors that are with our population, but we're kind of seeing a trend, and I know Camille can agree with me, where we're seeing this less willingness of families to allow us into their homes. Not so much for the medical case management, because that can be done telephonically and in home, but the actual lead inspection. Secondly is, with the lower blood lead levels, I feel like we need to kind of do, in addition to housing, because it's still the number one source, but look at some of the other hazards and what we can do to try to control them, and maybe do some more outreach and education, and provide information to families on those other hazards. And the other thing is, I mean, we've been saying this for years, but as we get more proficient at our jobs, the funding becomes less and less. And just sort of maybe brainstorm about perhaps other sources of funding to continue our journey in the reduction, in particular because we're lowering the level to 3.5.
If I could say one thing on the funding, that I want whoever's hearing this, people to know. I know Baltimore County just got a new grant in 2020. The city of Baltimore is sitting with about $19 million of unspent monies that they're starting to get out the door. But this is the highest budget year ever for the Office of Lead Hazard Control and Healthy Homes. And so I think it would be really incumbent upon counties who may be listening, or especially Prince George's, places on the shore, Western Maryland. There is an application due on October 18th for Healthy Homes production. It's much more flexible money. It can do lead and those other things that are necessary to get done to advance health-based housing. There's clearly lots of money coming, which I'm happy to do a quick brief for the Commission in either November or December about how the climate money can actually be used to advance equity and health and remove lead in its process. And I think we ought to address that. I do think this issue of getting to kids who we haven't reached is really important. I want to open it up to others' comments on this. And just I'll add one thing, Paula, in light of your comments. One thing we did learn during COVID was our virtual visits that we did built a lot of trust. And I'd like to see our own organization do more, not just telephonic, but online virtual visiting, so that we build that trust before we show up and people are more welcoming. But I wanted to open up the objectives piece to others, if there's anybody who wants to weigh in.
For statewide, that's the first question.
Yes.
I want to make sure.
The question Camille is posing, if you didn't hear, is this for statewide objectives for the commission? The answer is yes.
Second, there are some things that are happening, but it's happening jurisdictionally. You might have to go back and take a look at trying to highlight things, because specifically, Barbara's suggestion is now planning for reinvestment long-term rental properties. We have rental licensing now in Baltimore City, but other jurisdictions may not. So there are mechanisms in place, but it's not statewide. So that's why I want to ask a question. And Angela and Barbara, I love co-mark suggestions, because those are our favorite and the hardest, but the best to do. Was owner-occupied rental buildings to receive services of any type that have lead inspections, and in Baltimore City, again, it's rental licensing. So some of that is happening, and water testing in childcare facilities. I have to defer to Paula and Kaylee on this. Water testing is going on in a host of places. So some of that's happening, but we might want to pick out where. Am I making sense? Because some of the time, I guess I just want to hit on our wins early on, if some of it's already happening.
So I'm not sure, could you all hear that, Camille, or not?
I could hear, or we could hear her. When you pointed the camera to her, it was a lot more clear.
Okay.
But yeah.
Got it. But one of the highlights that she brought up was, how do we make consistent those things which are best practice going on or being implemented in Baltimore on pre-rental inspections, and how we are really doing that in every jurisdiction around the state, but also our opportunities with water testing and the monies that are coming on water. Kaylee, I don't know if you want to say anything in response to sort of how we're approaching the water piece.
I don't have a lot of detailed information about that other than I know that our water quality financing and water supply people are working on implementing the infrastructure law portions that deal with SRF funding for lead in water and service lines and things like that. We also, this is kind of a more minor thing, but we did a more intensive look at water during environmental investigations over the past few months. And maybe next time I can go through what we found in that. We just wanted to make sure that we weren't missing things with regard to water in environmental investigations because we don't sample water every time we go out. We kind of let the questionnaire guide where the inspectors sample. So we wanted to make sure as we start to look at these lower levels that we're not missing something with respect to water. So I think we were just waiting for a few results from that, but maybe that's something interesting we could talk about next time.
Yes, absolutely.
One of the things we've noticed over the past 6 to 9 months, there's been an increase of younger 22-year-olds with their first or second lead level coming in quite high, 30s, 40s, some needing chelation, some not. A lot of the families have been in rental properties for the 2 years, the entire time the child's been alive. We've had some other children that are 5 and 6 years old. They're having lead levels that are elevated. Those families have been in the home for the entire 5 or 6 years. There's been there reports of re-inspections, but it's very vague on what's been inspected. And when we try to follow up, they say, well, the contractor that came in, they inspected the areas the family said to come and look at. A lot of times the families are not going to necessarily say, come into this room and look where all that chipping paint is. And children get into these little places where an adult's not going to get. So if they have boxes piled in there or other things piled in there, a child can get their hands in there. An adult might not even think about it. So to make it more consistent throughout the state, and I agree 100% with what Camille is saying, there are certain areas that have it down. They have the plan in place, implementation is spot on, and then other places it's not. So just to keep that in mind when we're looking at it, to be consistent throughout the state, take into consideration what kind of inspections, what should be in a comprehensive inspection.
So this is really, I'd say, really an important discussion of if we are seeing now the result of higher lead levels post-COVID when families have been hunkering down in their homes, and that this is what we're seeing. And Camille, is this what you're seeing a lot, or?
Not a lot. 1 is too many, 2 is a lot, and 3 is through the roof. So we've seen a couple. What I can say, Barbara, is that if there's a specific address or issue, send it to us, and we can reach out to our partners at housing to ask that question. And even if it's a child that you suspect and there is no lead level yet, I mean, housing still has the ability to go in and do an inspection for lead and lots of other things. So let's have that conversation offline, and or send me an address.
So,
and I
are not safe.
Okay. Yeah. And
Well, then that's where we have the problem.
Because I'm happy to do it. And that's for Section 8, non-Section 8, or anything. Send me those. So.
Yeah, and this was my question, right? Are they mainly homeowners? Is this right? Are they in homeowner occupied properties where we don't get as often because the law doesn't take us there, and something that we ought to be thinking much more about? And if they're outside of Baltimore, right, where we have less resources. Jason, I hate to call on you, but in Baltimore County, are you seeing this trend of elevated levels? Are you aware of that? Yeah. Okay. So what I heard, one thing that I heard from you was is concerning to me is the health department's not telling the lead hazard control program elevated levels and making those referrals. I would like this commission to help you resolve that, because I think one of the key purposes of those programs, with the money that you have, is to certainly get to where we've had poisoned kids. And I'd just like to propose that we try to work on how do we help resolve that.
Ruth
So,
Ann?
yes.
Susan has her hand raised.
Okay, hang on one second. Susan, go ahead.
Thank you, Ruth Ann. Thank you, Wendy. I just from the, being kind of a foot soldier out there, one thing that I would say that would probably be helpful is I have seen from several different owner occupants who had elevated blood level children that some of the deterrent is the fact that they can get a violation notice. They don't want, they want to help their child, but at the same time, they don't want to get a violation notice on their house and have that stigma on their property.
So I don't know what happened there. We've got the echo again. But I think we have to find a solution to this, right? Whether it's a period of time, we help people cure this problem as a homeowner, or if there's a way, and I'd love to solicit some thoughts on this, on some things we ought to be thinking about. So I don't know, Cliff, Kaylee, anybody here or online thinking about how we can get past that. I'd welcome comments from our small but mighty audience too. Anybody thinking about that? I know, Paula, you've thought about this over the years.
Yeah, I agree with what Susan Kleinhammer said, that there is some reluctancy by families because, in particular for owner occupieds, for fear of, not of getting a violation notice. Baltimore City Health Department has to follow their regulations, and Maryland Department of the Environment doesn't issue violations on owner occupied. However, we do have the authority to issue an abatement order on an owner occupied if it is deemed. But I think we're seeing sort of both rental occupied and owner occupied, both being a little leery about people coming into their home. The suggestion that Ruth Ann had about perhaps engaging with these families more on a virtual basis prior to coming out might be something to, evaluate and look into.
But it does seem to me that we're kind of going backwards to where we were decades ago about the reluctance.
Yeah.
And what I would love to solicit from everybody who's here and thinking about this is what's the educational message that we really need to get back to an education campaign, because for a lot of people, lead's history, right? And so this is coming new to some people about why you want to come in my home and put a violation notice on me, instead of the message being, we want to repair your home, we want to fix it so your kids aren't getting sick. Cliff?
So the one thing I would say is I just want to give acknowledgement to both Baltimore City and the State Department of Housing and Community Development, because there are more funds available to address owner-occupied homes, both through Medicaid CHIP and through other resources. And I will say that I think the local health departments, and we can talk to the local health departments about this next time, I think the local health departments are trying wherever possible to engage with the owners around the issue of how can we help you to address this problem. I think that the issue sometimes is that initial reluctance to talk with the health department. Part of that is a function of COVID and other things and some suspicion about government naturally. I agree with you, however, that especially taking Lead Poisoning Prevention Awareness Week and other opportunities to do some education around the resources that are available to help people. So I think that in some ways, we've always known that we're entering this new phase where we're sort of in the last 10% of the struggle to eliminate childhood lead poisoning. And that in some ways is the most difficult part because we've, in many cases, gone over the most obvious sources. There are still many of those out there. But for people who are now seeing their children with relatively low levels of lead, figuring out how to engage with them around, we're going to identify as many sources as we can and abate them. And we have resources to do that. That's a positive message that I think the local health departments and the departments of housing are trying to emphasize.
All right, we have 2 hands raised.
Yep, okay, and then we'll probably move on to the next section.
All right, Catherine Taylor's hand raised, and then Susan Kleinhammer after Catherine.
Hi, I'm the program director for the Lead Hazard Reduction Program with Baltimore City. And I have to agree with what Cliff said, that there are resources for these owner-occupied units. Like my program, we do focus on both owner-occupied and rental units to, help out those families to do the abatement or interim controls. So having those health departments or any type of organization send a referral to our program, we can definitely reach out and not only help the family with remediation, but also do education as well.
And sorry for the echo, but I want to remind people again, Baltimore County has funding, Baltimore City has significant funding, and the monies that we are going to launch, we'll talk about the 1,000 homes that have come from the ARP allocation made by Mayor Scott this past month. The money that has been provided from the Senate, all can be used in both homeowner occupied and rental properties. So if you have families that have this concern, Tiana Shepard is here from our staff. Please ensure that they get to Tiana, and we will make sure that they get to contractors, to programs. And if you're across the state, we'll work to make sure that the CHIP program is addressing that. We're going to be encouraging counties across the state to apply for monies. And as we have a new governor coming in, we're going to push, I know GHHI is, I'm not saying the commission, is going to push for more funding to match things like CHIP, so we have more resources across the state. There are resources. I think one of the things we should concentrate on as a commission is the reticence of having people in their home and understanding that what we are trying to accomplish. So one of the things we're trying to accomplish at GHHI is it's not just fixing lead. We are going to be doing energy efficiency, asthma reduction, trip and fall prevention, trying to meet people what they see as their immediate needs and what we know are risks in their homes. Cliff has his hand up, Wendy, but I know you said Susan had her hand up.
Thank you both again. I guess let me finish what my main concern was. It's not owner occupied versus rental necessarily. It's also middle class owner occupied that don't always meet the eligibility requirements of all that money that you're talking about that's available. That's the real issue. That if you really want to get to it, most middle class, upper middle class children are lead poisoned through renovation, but they don't meet the eligibility requirements that are oftentimes set with those federal and state funded programs. Thank you.
Well, I will say one thing. We have tried a number of times in the state to pass a tax credit for precisely that demographic. There are going to be funds around climate that will go to middle income families as well, that when that work is done, it includes removing the health and safety issues. So we should pay attention to that. We'll outline that in future commission meetings. And the CHIP money is more flexible on income. And some of the state housing and community development programs are also more flexible. But we have to get the data on that. So if you have families that are not eligible for grants, and we know that we can look of how we can create and access those resources for sure. But I think one of the things we ought to get serious about is the tax credit or tax rebate that can help middle-class families. Cliff, you have your hand.
So I have two comments, both directly relevant to this. One is that some other states have actually created pools to help middle-class folks who are not eligible for other programs. And so I can say that some other states have done this by actually creating some resource pools where they have done that. And on some national calls, I'm sure you've heard of some of the innovative financing approaches that other states have used, because tax credits may not always be useful because it's the initial outlay that is the challenge for people. The other thing I will say, and this is a comment directed mainly at Paul Rogers and Barbara Moore. If you look at surveys of trusted agents, we know that the family healthcare provider, the primary care provider, is often the person who is seen as a more trusted agent than those of us from the government and the public sector. It seems to me that one of the ways that we do need, and we have done some of this with continuing medical education, but I think there are more opportunities to engage with primary care providers, because when they are confronting a child with lead, I think that part of the issue of both with middle-class families who are very concerned about the health outcomes of their children, and for other families for whom they are equally concerned about those outcomes, for all of those families, that engagement with the primary care provider, giving the primary care provider a message that says there are resources and referrals that I can help you with to provide access to this, is, I think, a gatekeeping function that would be important for us to try to emphasize.
Great. Mangela has her hand up, Wendy, and I don't know if there's others, and we'll make Mangela and Camille the last comments on this.
Paul Rogers also has his hands up.
What Paula talked about entering into the families for lead inspection. The Maryland State Department of Education Division of Early Childhood, we never stopped going into the families and to the facilities. Even during COVID, we started with the virtual inspections. And then we slowly transitioned to hybrid inspection, where we were able to.
Wendy, can you still hear us? I think she can hear us on the phone.
Yeah,
Wendy, can you hear us?
Yes. Yes.
Yes. Go ahead.
Hybrid, and now we are actually going in person to all families and the facilities. How this happened? We continuously conducted listen-in forum in the evenings, actually advertised, put it on the newsletters and on the website, had the people to sign in. And each time we had like 400, 500 individuals at the families signing in to listening to the session, to really get that information, what we are focusing and what our objectives were. And it is really helping, and they have great trust, and we are there. It's not just for the routine inspections, even for complaints investigation that is endangering the health and safety of the children or the families. So that's one thing to take into consideration. The second one, with the money is available now, we would like for the commission to have the focused outreach. Though the grants are mostly based on the income and the income levels, could we make it as a pool, like what Dr. Mitchell said? I really love that word pool. Like, make it as more flexible. Who are the people who would be eligible for these monies? Is it just the income based, or also could we say like the building, the people who are living in those buildings that built certain years, or water supply? So now we have the data, the risk factors. Could we just put the risk factors into eligibility category for people to apply for grants so that they could really mitigate those efforts? So focused education really needed when we say like apply for the funding, but people really do not know for what they would qualify for, and what would really that would impact the children's health that are living in that family and in the community. So focused education would be helpful to entertain more applicants and to actually spend the money for focused reason for lead prevention.
Fantastic. Camille?
So very quickly, and I hate giving Cliff and I more to do, but we may have to spend some time with the other health departments talking about their relationship with local housing departments. I've been lucky enough, and I tend to take mine for granted, that I can pick up the phone, that if they don't qualify for lead hazard reduction, well, let's try weatherization. If weatherization doesn't work, then let's try this. So some of it has to be done on the local level. I certainly want us to do it simultaneously, certainly work out the state level, but things about data use agreements, we conquered that, but we also had to change our consent forms to let folk know that we were sharing their information. So there's some other stuff that has to happen simultaneously, but there's lots of work on the local level, unfortunately, and this is just in general, that folk don't know what resources are out there. And it's just homeowners in general. It's not just around lead, it's literally homeowners that didn't know that this pool was open. So if the state doesn't work, then the levels, the qualification levels are a little different on the local level. And it literally is having that pool, but also breeding your funding and applying across several platforms, if that makes sense.
Amen. That's the outcome, right? I brought that back from you. Wendy, do we have any other hands up? I know we need to move on. This has been a
Can you hear
great
me?
discussion.
Can you hear me?
Yes.
Okay. So Paul Rogers has his hand up. You want to go ahead, Paul?
Oh, great. Thank you. I just briefly wanted to comment on Cliff's comment. We just started our ECHO program and we've had our second session. We're working with 17 pediatric practices across the state. And one of the questions that came up in our yesterday's meeting was, what can we count on the health departments for resources and help? Where can we go to get help that we needed? So I was going to contact you offline, Cliff, to see if you can put together something to help us educate them in more detail too. Okay, great. Thank you.
We're going to take all these comments and try to put them into that grid, into an action piece. I just wanted to ask of any members of our public community who are here, they've grown in mighty number. But if anybody has any comments on what you've heard or suggestions, an opportunity. Going once, going twice. I do see Alexia in the audience who is running an EPA grant in the Baltimore community, and I think there's a lot here, Alexia, that has can be great discussion in the convening that you're doing with families across Baltimore. So Wendy, I think we're going to move to the next thing on the agenda, which is a brief, tight presentation of those who are involved in Lead Poisoning Prevention Awareness Week. Jamel, if you're part of that, or you or Wes, if you could come here and we'll turn the camera for anything that you're reporting on that. But Cliff, do you want to say anything about what we're doing from the health department standpoint?
So for lead poisoning prevention awareness, we have a number of things that we're talking about, but the key messages for Lead Poisoning Prevention Awareness Week this year have to do with the transition from 5 micrograms to 3.5 micrograms on October 28th of this year for notification of parents and property owners if there's a child who is found to have a lead level of 3.5 micrograms per deciliter or above. Primary care providers are already doing this in their practices. They are already acting on 3.5 as of earlier this year when the Department of Health sent them a note to do so. But now officially, MDE, and Kaylee can comment on this, will be notifying, and we're working with the local health departments so that they're all lined up for this as well. The other big piece of that is the continued importance of getting testing for children. We continue to see that COVID-19 and other post-COVID-19 recovery has depressed visits to providers and testing rates, as well as immunization rates. So we are making a concerted effort over the next year to try to improve those testing rates. And we'll talk about some of those efforts.
Fantastic. I have in front of me, can you all, sorry about that, a list. I know Chevelle or Wes, you can help out a little bit, but Lead Week begins on Sunday, October 23rd. There will be a joint agency social media campaign with HUD, EPA, CDC, but here in Maryland with the Department of Environment, Health, GHHI, the city, and others. On Monday, we are going to launch the 1,000 Home project in Baltimore, where we will be providing full funding for 1,000 families in Baltimore to do energy efficiency, which also will include electrification for climate advancement. We will be doing full lead hazard control, weatherization, asthma reduction, and trip and fall injury, all in one holistic approach to housing. We will be targeting the community near this school, as well as work throughout the city. This is being launched in a large partnership with lots of agencies. HUD, the mayor of Baltimore has put in money from the American Rescue Plan, Senator Van Hollen from the Senate, and we have other philanthropic and government funds from DHCD, DMH, and others. And we're very appreciative of the ability to have such a comprehensive launch. It is not all that's happening, and there are many things happening. We will be doing more than those 1,000 homes, but we are launching that with Secretary Tablada, Mayor Scott, and our agency partners. On October the 25th, there's a tour for Derek the Dinosaur. He's doing a book read around the, is that right? And do you all want to take the rest of this week and tell us what else is happening? Derek, by the way, today greeted all of the kids at Henderson Hopkins, and it was a mob scene. So,
Yeah.
Alexia and Les.
Yep, and Chevelle, thanks. So again, everyone who's having events, please let us know. Chevelle and Alexia heading out, putting together the statewide calendar. So please share that. As Ruth Ann mentioned, there's 3 really big events that we really want you to participate in, as well as what you're doing locally. Also part of that Monday kickoff here in East Baltimore, we're going to go block by block after that press event and make sure that people link to resources. So we're going to go enroll families in all these different programs that Camille and others were talking about. The Prince George's County event is going to be Thursday or Friday. We're also going to have a press event at a health clinic in Prince George's County. It's being moved because the commissioner is actually retiring on Wednesday the 26th. So they've asked us to hold it a different day. So that's going to be in Prince George's County. And then another really important event here in East Baltimore is a lead and water convening to find out where do we stand on lead service line replacement in Baltimore. Where are we on lead and water in schools? And so we're going to have the different agencies report. We're also going to have an update on where families can go to get resources as it comes online to actually have your service lines replaced, but also where are we on lead and water. So that's going to be a community environmental justice convening here in Baltimore on Thursday as well that week of Lead Week. So. Yep.
No, the convener will be, like was stated, that Thursday. If we plan to host it that evening from 6 p.m. to 8 p.m. And we're looking to make sure that it's a very interactive event.
On the weekend, both Saturday and Sunday, we have lots of families from Anne Arundel, Baltimore, and Baltimore City come out to the zoo. So that's a big 2-day Olympic event.
Everybody's favorite event, Zoo. So,
Yes.
Absolutely. Dress up in your favorite costume. All right. Well, thank you all. Camille, anything from the city or childcare or anybody else want to add?
Baltimore City actually stirred as we listened for the first time in a really long while. And we're partnering with the Enoch Pratt Library. So we're going to be there in the morning from mommy and me time to the Team Look Up time. So they will see us, we'll have conversations, and we're literally in libraries, in neighborhoods with the testing rates are low. So literally every day that week, we're in a library from Penn North to Hamden. We're actually going to spend a little more time at Penn North as well. The week before, on the 17th, we are relaunching our media campaign. So Charles Street Station, I purposely put one across from Cliff's office at the state office building, but you will see this little guy right here
on the sides of
Can you turn that
buses.
around for the camera there?
And I'll send it to everybody. Metro kiosks down below in the subway, up a side. So that's going to launch on the 17th, and that actually is going to run through December.
If you're from
as well.
Baltimore in the audience, please take one of those, share that with your favorite civic association, church, childcare.
We have loads of them.
There,
Yeah.
there you go. Anything else? Anybody from the audience have anything that you'd like us to highlight? Yes, Jason.
Sorry about that.
No, you're fine.
Hi, Baltimore County, for the whole month of October, we are running ads on MPT and WBAL for Lead Week, but we're actually doing it for the whole month. Some of these ads are going to be for targeted zip codes for Baltimore County that has a higher percentage of lead paint. And we are also doing in-person events as far as you said, the libraries. We've been going to 4 libraries weekly for the past 6 months. Randallstown, Catonsville, Woodlawn, and now Essex we'll be going to.
Fantastic. And the connection between grade level reading and lead poisoning is a real thing. So really appreciate that great outreach for Baltimore County. And if you share those with GHHI, we will, and the city or the state, we will put all of this up on our website and share it through our constant contacts so that people know. So that is wonderful. And thank you all. We look forward to that. We are going to move. Paul, it says you have a public education video reel.
I do.
Wendy, can you play that?
I'm sorry. I just have one before we get into this because I just had a thought. Cliff, do we know how the impact of lead care 2? I mean, I'm sure we'll know how that's because I think it ran.
Can you explain to the public what lead care 2
sorry.
is?
Lead
please?
care 2 was so it was approved several years ago that when instead of sending families to labs that they could do in-office lead testing, and the results would be sent to a organization that would read them, and then they would report those hard copy results to the Maryland Department of the Environment. So there was about a 30% rate of in-clinic testing with this instrument called the lead care 2. Well, apparently there were things that happened to the testing that questioned the results. So Magellan, who was the manufacturer of lead care 2, recommended that it no longer be used for in-office testing. There, like I said, there were about 30% once it was approved of tests that occurred in office. So I'm asking now, could that be, which I'm sure it probably is, impacting our testing rates, which,
And we're going to go over to the sources here, Cliff, Paul Rogers, others, but Cliff, I think you're up.
Yes. So what Paula is asking about is in 2020, I want to say, there was, I believe it's 2020, some of the test kits that were distributed by Magellan for the lead care 2 were found to have essentially the possibility of producing what are called false negative results. And what this means basically is that if they said that your lead level was very, very low, that might not necessarily be the case. Now, that was a problem with manufacturing the test kits, not with the test instrument itself, but with the reagents that are used to analyze the lead care 2 test results. So the FDA, CDC sent out advisories and essentially stopped lead care 2 testing from taking place while the manufacturer addressed the quality concerns in the manufacture of those reagents. Subsequently, that problem was corrected, and the lead care 2 is back in service and continues to have testing. Now, what we are going to wait to see is the effect of testing at low levels. With those low levels of 3.5, we're going to wait to see what happens with those levels in lead care 2. But in the manufacturing of this instrument, which has been around for more than a decade, it shows reliably low levels. The concern with the lead level with the lead care 2 is more when you see somebody with a high lead level. That can be because you don't correctly do the test, but it has been shown to be reliable for low levels of lead. We are going to wait to see as we do more testing at low levels and more children have low levels. We can still be fairly confident that those low levels are low, but as we get lower and lower, that reaches the limit of detection of the test. So I'm sure that CDC and FDA are going to be evaluating what happens with the lead care 2 as low lead levels continue, as low lead levels in children continue to decline in the United States.
Thank you. Wendy, do we have any questions around that from anybody in the audience? Or online?
Yeah, can you hear me? Can you hear me? Okay.
Yep.
So Christina was just asking that she typed in the chat, please share the resources mentioned in order to share with childcare facilities, to share with threat families as well.
So everything discussed here today, we will make sure it gets sent out to everyone, and anybody who's signed up will happily share those as well. And Jason, if we can get from you the Baltimore County events, we want to make sure we do that as well. So we're going to move to the Maryland Insurance Administration. Benita's got I think a quick.
You want me to
raise
hand
the video? Oh, sorry, the video. Yes. Apologies, Paula. Yes, let's do.
Apologize.
I'm apologizing. Run
All
the
right.
video, Wendy.
Yep.
What's the most significant and widespread environmental hazard to children's health?
Wendy, unmute your screen.
Neurological damage, as well as learning and behavioral problems. Prolonged lead exposure may cause future health issues such as heart and kidney disease. The Maryland Department of the Environment maintains data on all children tested for lead in Maryland. Children with blood lead levels have steadily declined since the implementation and enforcement of Maryland's 1994 Reduction of Lead Risk in Housing Law. Under the law, MDE assures rental units built before 1978 are lead safe and maintains a statewide listing of registered and inspected units. MDE oversees medical case management and performs investigations for children with elevated blood levels. MDE also accredits and performs oversight on inspectors and contractors performing lead services. MDE participates in outreach and education to parents, tenants, rental property owners, contractors, and homeowners to enhance their roles in lead poisoning prevention. In 1993, 1 in 4 Maryland children had lead poisoning. In 2020, 1 in 400 Maryland children had lead poisoning. That's a 98% decrease and the lowest levels since data collection began. MDE leads the charge in the prevention of childhood lead poisoning by partnering with the Maryland Department of Health and local health departments, the Department of Housing and Community Development, the U.S. Environmental Protection Agency, the Centers for Disease Control and Prevention, and HUD. For more information, visit mde.maryland.gov and search lead.
So, Paul, how are you going to use your video? Well
Okay.
done.
Thank you. Actually, that was my voice, but just it's not really me. Actually, it came from the Office of Communications, Richard Gardner, which I'm going to give a shout out to right now. I didn't even realize that was his voice. I'm like, how did you get the voice on there? He's like, well, that's my voice. And I'm like, oh my goodness. Well, anyway, this is just a kickoff video, okay? Our plans in the future are to do additional videos where we talk about resources, sources, and highlighting inspectors and contractors. So there's going to be a series of resources available in video style to try to make compliance with the state-led laws and accreditation a little more simpler for people out there. So this is going to be released on our website during Lead Week.
Fantastic.
So it's our first attempt at trying to simplify a complicated issue.
Well, we will try to share it and invite others to do lots of the same and doing that. And thank you. Congratulations on getting that done. Benita, you're online. Can you share with us? I know this is a response to a New York Times article last spring. You were going to look at what we found in Maryland as to whether or not we are at risk for some of the things. If you could give some background and just your findings.
Sure. Good morning, commission members and guests. My name is Benita Cooper, and I'm with the Maryland Insurance Administration. I would also like to take the time to introduce our Associate Commissioner, Robert Barron, who is the Associate Commissioner for the Property and Casualty Division.
Hi, everybody. Go for it, Benita. Thanks.
So back in March, Ruth Ann asked me to take a look at the New York Times article about how the insurance industry had, in that specific article, appeared to wage a decade-long campaign to avoid liability in lead cases. And I'm glad to say we have not seen that has been the issue in Maryland. And as we know, in the 80s and 90s, there was an influx of claims in the 1990s. They came up with the qualified offer that was later overturned by the Dackman decision in 2011. As a result, insurers do and can do still utilize lead paint exclusions within their policy as long as they waive the exclusion for the existing qualified offer amount. With respect to the instances that were raised in the New York article, you can draw a lot of differences as to why they were experiencing that. As we know, each state has their own set of laws, federal laws, that would be applicable in these situations. But I work specifically in complaints, and we have not seen a rise in these type of complaints, and really don't see it as an issue in Maryland.
Well, I appreciate your look into this. Always better to be safe than sorry, but it also says what a great job you're doing, and we appreciate that. Are there any questions for Commissioner Cooper? Seeing none, we're going to move to, I think, Jonathan. Kaylee, is that right? That Jonathan is going to, on behalf of the Maryland Department of the Environment, is going to present the annual, sorry? Rena, sorry. Present the Maryland Department of the Environment annual report to the commission. So this is for 2021, having analyzed the data for 2021. I'll turn this over to you all.
Good morning.
Good morning. Good morning.
Absolutely. A special good morning to you, the commissioners, the administration, colleagues, advocates, and guests that are in partnership with the Maryland Department of Environment to protect the public's health and the environment for Marylanders. I am Dr. Rena Boss Victoria, the section head for surveillance and health at MDE, and I'm pleased to share with you today the preliminary data report on childhood-led registry for the calendar year of 2021. We are reminded once again that this is a celebration of the combined efforts in this special meeting place among a very special group of people to recognize the National Children's Environment Health Month and the National Lead Poisoning Prevention Awareness Month. It is our intention at this time to promote as well as advance the vision, purpose, and functions of the Lead Poisoning Prevention Program as we continue to evolve to meet the challenges related to systematic tracking of elevated blood levels in children ages 0 to 72 months that are residing in Maryland. Our first slide will begin with the history. That is the history of the lead poison program. Today, of course, we are focused on the next steps that will, as many have reported to you this morning, on our transition to the October 28, 2022, with the announcement that the elevated blood levels being reduced to CDC reference level of 5 to 2. To 3.5, excuse me. The public's awareness and education about services.
Reno, we lost your audio.
Am I back?
Yeah, you're back.
Okay, that helps. We are focused on the next steps. And so from that position, we are promoting awareness that the state lead poisoning prevention program will incorporate House Bill 1110, Chapter 26, Acts of 2022. This will be effective October the 28th of 2022, when a child under the age of 6 or a pregnant woman has an elevated blood level or greater than and equal to of 3.5, the Maryland Department of Environment or the local health department must notify the patient or the guardian or the pregnant woman and the property owners of their status. This notification is essential to our operations. Within 10 business days of receipt of a test result, diagnosing a child under the age of 6 or a pregnant woman is with that elevated blood level of greater than 3.5 or the local health department, we must ensure that these entities, including the parent or guardian of the child or the pregnant woman, as well as the owner of the property where the child or pregnant woman resides or regularly spends at least 24 hours per week, is notified by mail. The next slide is presenting all of the Maryland Department of Lead Poisoning Prevention Program departments that are comprised. These are the Compliance Division, whose main focus, of course, is to ensure property owners' compliance and perform environmental investigations, elevated blood level investigations. The Lead Accreditation and Oversight Division, that main focus is to manage accreditation programs, to accredit third-party lead service providers, and perform oversight inspections to ensure compliance of lead service providers. And next is the Lead Certification, Registration, and Compliance Division, whose main focus is managing and maintaining the rental registry for the purposes of monitoring compliance of affected properties. And finally, the lead surveillance section, whose main focus is to track, report, and disseminate blood lead level information received from medical service providers in the state of Maryland. We will just explore in regard to the lead compliance division. As I said, their primary focus is to conduct environmental investigations according to COMAR 26.16.8 and the HUD guidelines, chapter 16. Also to ensure compliance, provide education and outreach, and take action on non-compliant rental property owners, as well as to develop and negotiate corrective action plans through settlement to possibly include the supplemental environmental projects. The lead compliance division was presented to the lead commission during the last meeting. However, highlights again was to include that from fiscal year 20 to fiscal year 21, there was an increase as it related to House Bill 1233 of 2019. There was the notice between referrals for 5 to 9, as well as an increase for those that were from 10 or greater. For fiscal year 2022, this is a mid-year fiscal year 21 to 22. There was also, they received 360 blood lead level referrals for 10 and greater. And additionally, they covered the Baltimore City Health Department's EIs for 1 month, in which the total was 487. Next slide. The Lead Accreditation and Oversight Division is indeed responsible for managing the accreditation program. This reviews the process and makes appropriate determinations for lead accreditation applications from prospective lead paint inspectors, the inspector contractors, supervisors, as well as abatement contractors and training providers. They perform inspections and audits, as well as perform oversight inspections and audits in order to ensure quality assurance. As for example, they provided a random MDE lead inspection certificate statistic that in 2021, Maryland accredited inspectors, contractors issued 24,770 lead inspection certificates and an estimated 149,000 documents to be processed. For each certificate depends on the certificate type and it requires supporting documentation. The lead rental registry receives the papers and electronic registrations and renewals of rental properties built before 1978. It maintains this data in the online lead rental registry database. It confirms the tenant moved in dates and inspection certificates from owners and property managers. It also validates that information for compliance with the law. It investigates potential violators and notifies those owners of identified violations. This registry submits enforcement cases to the Office of the Attorney General if violations are not resolved. The lead rental registry has reported that by the fiscal year 2022, which was at the midpoint of June 30th, 2022, that they had indeed had new units regulated and registered doing at 2014. Therefore, it shows that that process is ongoing. For the lead surveillance division and section, we have prepared the tables that is to present primarily the vision or the view from the calendar year of 2020 statistical report to the mid-year statistical report for the year of January 1st of 2021 through June 30th of 2021. It may be noted that it is reporting the number of tests, the number of children at risk, ages 0 to 72 months or age 6, and number of children by age, number of children by gender, and the blood lead levels, and finally, the blood specimen types. We give quite a bit of attention to that blood specimen type because, again, the capillary is not our preferred or the best report in order for us to give to confirm that there is the case that would be referred for case management. If indeed we receive capillaries, and we try to encourage that the initial sample, if at all possible, would represent a venous sample, would in fact allow us to do the confirmatory. It may be noted between the view of 2020 to our midpoint that there is indeed more testing at this particular point of the year post-COVID, because of many of our parents are indeed taking their children into the clinics. Many of the parents are indeed in a position to be able to follow the primary care physician for retesting. Again, our focus is about education and awareness and trying to ensure that all of our partners are aware of how important it is to have a concerted effort to improve our testing rates. This slide presents the at-risk children ages 0 to 6 years old by jurisdiction. Of course, the 23 jurisdictions are indeed indicating for those with blood lead levels greater than 5 that they too are beginning at the mid-year, beginning to demonstrate that continuing increase and receiving post-COVID the testing to support our confirmation. This slide in particular gives attention to the laboratories. In working with laboratories in 2021, we continue to try to encourage that we get all the data that is required and mandated to be involved in the reporting. We have always had difficulties as it relates to the race and ethnicity, and we are trying to continue to encourage the completion of those particular categories. However, we are definitely having a improvement, I would say, as we relate to reporting of the sample type, as well as trying to improve the address validation, as well as trying to have a phone number for contact and that initial contact when case management is the prescription. This slide presents our current and ongoing reporting requirements as of July 1st, 2020. And definitely there has been no real changes in the reporting requirements. It's simply a matter of reinforcing now that the blood lead level is have lowered to the greater than 3.5, and we are trying to ensure that within 24 hours after that test is finalized, that all of the results can be reported up to that 2-week window. I will stop here and receive questions and comments.
Well, first of all, Dr. Boss, want to thank you for this. I think this is your first year taking this on. So we appreciate you very much putting this together. Are there questions either from the commission or the public on the report? Yes, and if you would identify yourself, please. Oh, sorry. Yes, Barbara's yielding to the young lady in the audience.
Hi, everyone. My name is Kalia Young. I am a community organizer with No Boundaries Coalition. And I have a question. I'm not sure if it would be for Ms. Rayner for the commission, but are there any lead testing requirements or mandates currently in place for students? So I know in the past, and this could still be true today, that students had to have certain vaccinations or tests done before they could register for school. Is there anything where, lead testing will be a part of that, since it does affect a child's learning and their academic experience, where you would test them early on to, kind of catch that lead poisoning sooner than later?
So I'm going to turn this to Dr. Cliff Mitchell from the Maryland Department of Health, and I want to thank you for being here today and working with us.
Kalia, thank you so much for the question. So the Maryland Department of Health Code of Maryland Regulations 101104 actually requires that children who are being enrolled in either pre-kindergarten, kindergarten, or first grade must demonstrate, and actually I happen to have the form here because we're going to talk about it a little bit. And to bore you further, it's Form 4620. But that really is that report must be given to the school demonstrating the child's lead level. And unless there's a reason why, a bona fide reason, a real reason for religious purposes why the child was not tested for lead. I'll also add, before Mangela reminds me, this is also required for children who are enrolled in licensed daycare programs. They must also demonstrate a lead level.
Great. We have Barbara, if you don't mind, we have a second question from the audience, and thank you. And Alexi's going to bring you a camera and a microphone to identify yourself and your question.
Good morning. My name is Thea Becton. I'm a program analyst with the U.S. Department of Housing and Urban Development. I'm with the Baltimore field office. I actually just had a clarifying question related to the data that was shared. I just wanted to confirm that fiscal year 22 midpoint had 2014 new units that were recorded in the registry. Did I write that down correctly?
I think that is correct, but Dr. Boss, do you want to answer that, or Kaylee answer that question?
Well,
Victoria?
yes, I think, yes, most definitely that is correct. I feel that.
And welcome, HUD. We're glad to have you. I'm trying to get people to apply to your programs. So, yes, well, good news if they apply, right? Barbara.
That's West Victoria. Question I had, what percentage of the population of children aged 0 to 72 months were actually tested? Because I know that's a problem we've had in the past. Our goal is obviously to get to 100%. We're not there. Do you have an idea if we have that data and what percent, and then further broken down for 12 months of age and 24 months of age?
Well, as indicated on the chart that was presented, I was just looking at the January 1 through June 30th calendar year. We definitely said those that were at 1 year old, look, well, I'll start with the under 1, was at a 7.8%, and those 1 year olds was at 35.2%. And of course, the 2 year olds was at 32.7%. So those well child visits and early intervention programs have definitely continued to work to ensure that we try to get the testing as early as possible. I feel that as we move forward with our data entry for the second half of this year, that it will be reflective that I'm not going to say it increased, but I will say that it is consistent. And that is basically why we're definitely aiming all of our communications and interventions in the case management to ensure that those young parents have a better understanding of why, when we say that they need to ensure that the children go back for retesting in order to bring follow-up for the primary care case management in a direct communication with the guardian and or parent. But it would be difficult, Barbara, for me to give you a true factual estimate for the year based on where we are with our completion of the data input in the database.
Ruth Ann, are you there?
I can't hear her.
Yeah, I think she got disconnected.
And Dr. Boss Victoria, thank you for the. I just have one clarifying question. Would we be able to have the number of children tested per county and the age group? So the lead surveillance, the at-risk children for ages 0 to 6, we have the children listed, number of children listed for each jurisdiction. But it will be helpful if we know per county how many children were tested and the age group, age breakdown, so that we'll be able to focus, really promote our focused education to the counties and also promote testing. Thank you.
Thank you. And that is the attention for the, as you know, this is a preliminary. This is a preliminary. I'm sorry, it seems to be echoing.
Yeah, I just unmuted it. Go ahead, Rena.
Yes, that is the intention, and to ensure that that will be a breakdown that is provided when the complete report is submitted to you. At this particular time, we are actively in our data entry process for the second half of the year there, and those numbers cannot be reliably shared based on it is not a complete process yet. So as soon as that is completed, this preliminary report will be updated with additional presentations as it relates to each of the counties and jurisdictions.
Well, I appreciate your report. I think we're going to move to the final part of our agenda. I think we've already spoken about the 1,000 homes, so I'm going to not address that further. But please be on the lookout in social media, in the press, about the first 1,000 homes that we will do with the whole house approach, launching here in October. I wanted to just ask anybody on the commission if we are aware of pending legislation related to lead poisoning prevention in the coming legislative session. Wes, are you aware of any that is pending? Right. Okay. Yep. So Cliff, I think you covered that on the implementation side. So we will move.
Susan
So
has
this
her
is
hand
our
up,
hot
Ruth Ann.
topics, current events.
Ruth
Shout
Ann?
it out, whatever you like.
Ruth Ann, can you hear me?
So Cliff has got his hands up here to go.
So
Ruth
I've
Ann?
provided to the commission, thank you, Wendy, and congratulations again.
Can you hear me?
A draft for the commission's input and feedback on a revised Form 4620, which is the Maryland Department of Health form The big change in this is that we have removed all references to zip code testing or anything that doesn't simply clarify anywhere in the state, any child needs to be tested. So I'm happy to have feedback from the commission at any point. We will be submitting this for, if we don't get any comments back in the next couple of days, we'll be submitting this to be officially become the new form. I will also say that I've had some preliminary discussions. Thank you, Mangela and Christina, for the suggestion about incorporation in the immunization record. We've had some preliminary discussions. It's a very complicated task. It's not going to happen right away if it ever happens, but I am addressing it with the immunization folks. So thank you for that.
Big
Ruth
fan
Ann,
of
can you
doing
hear
this
me?
at the time of immunization. It's really super important.
Ann.
And also to remember that it's not just kids 1 and 2 that we need to test. I think
All children under 6.
we need to be testing 3, 4, 5, 6, and sometimes beyond, depending on housing condition. So just to remind everybody on that, I have 2 hands up, 3 hands up. Let's go first to Barbara Moore, and then to Camille, and then to Susan.
Also, just to add on to what Roseanne said about the housing condition, also consider the child's developmental level. Because a child over the age of 6 with certain disabilities may have an increased risk of pica, putting things in their mouth which is not food, and for that to be taken into consideration when testing is being done. And then the challenge, unfortunately, is trying to find resources for those children.
Quickly, on the bona fide religious belief section, that's the healthcare provider attesting to the religious beliefs of the. I just want to be real clear, and I said that way purposely, because I'm getting the question, and I want to make sure I explain it.
Yes. So just to be clear, the form must be completed by the healthcare provider in that section based on the religious belief of the patient's family. But the patient doesn't attest to their religious belief and an exemption themselves. The form should be quite clear that it must, and I believe that box, this must be completed by the child's healthcare provider if a religious exemption is being claimed. So it cannot be signed solely by the parent, must be signed by the provider.
Second question, among the screening questions, the one thing we
speak up just
always
a little
ask, sorry, the one thing we always ask for the healthcare questions are we ask the parent, did they have lead poisoning? And that's the one thing I think is missing. And it's a tough question to ask, but it just gives us it just tells us a lot.
Can you, just for everybody's education, explain why you ask whether the parent had been lead poisoned?
Sure. When a child is exposed in utero, that child starts off. It starts off life in a different place. So it's important to know where the parent started off, so you can actually help the parent help the child, for lack of a better way to put that. But it affects them. I mean, if it affects them in utero out the gate, and we have quite a few intergenerational lead. So that's why we ask the questions right off the bat. And we don't ask to clear it. I know there's not a lot of space, but I wanted to put that out.
Is there a reason we don't ask that?
Well, there are a couple of reasons. The first and most important is that our goal in getting kids to be tested, we don't want to necessarily prejudice the parent that we're asking about a health question of the parent and not of the child. And so certainly as the primary care provider probes more, that question often comes up in the case of the history. But we are making as much as possible to base the screening questions on recognized risk factors in the literature. There is less literature actually about whether or not parental lead is actually a risk factor for childhood lead exposure. And so we've made the judgment based on best available medical evidence. It's a reasonable question to ask, but at this point, we're trying to be conservative in order to encourage parents to have no qualms about getting their child tested.
It sounds like an important paper we may want to pursue talking about. Okay, I think Susan had her hand up, and then Mangela and Paula.
Thank you, Ruth Ann. This is a little bit of a question about a discussion a little bit before this, but I wanted to know, I know that the Centers for Disease Control's blood lead level, reference level of 3.5 will be enacted here in Maryland late October. However, the minutes had said that it will not be until January 1st, 2024 as to when an environmental investigation will occur at that new 3.5. My question is, what is happening to affected properties that receive a notice of a child with a blood lead level of 3.5? They are required to do modified risk reduction if there's a notice of defect. However, if the environmental investigation is not going to occur for more than a year after we go down to 3.5, there is this time frame where we are doing what? That's my question.
Who wants to take that? Kaylee.
So we had this kind of phase in when we went down to the level of 5 also, where we went to the level of 5 first for the notifications and then later for the environmental investigations. So we have the same kind of phase in happening here. So for that interval of time between October 28th of this year and January 1, 2024, there will be notification of the property owner for informational purposes. It doesn't trigger action on their part. And there will also be notification of the parent of the child, and information will be provided about how they can file a notice of defect. So that's one important tool in that interim period of time that could be used to address defects in the properties. And that's something to focus on in outreach, I think. But otherwise, there's that interval of time where it's essentially informational tool that we're providing before we start the environmental investigations.
So just to follow up then, Kaylee, so that there will be no triggering of modified risk reductions at a blood level of 3.5 until January 1st of 2024. Will a modified be triggered during that time period if the old reference level of 5 is reached?
Yes. The answer is yes. And the notice of defect can trigger that modified risk reduction. But Kaylee, this brings me to a second point, and I'm going to take a purview of the chair for a second to simply say, MDE is currently not funding community outreach education, although there is a codified section of the law to do so. This seems to me an opportunity to get money out to community groups, to others, to do education, and to consider funding again the legal services position so that the notice of defect has meaning, has teeth, and has importance in this gap period. So I think this is really important. I have raised this with Secretary Tablata. I raised it with Secretary Grumbles. Failing to have that out in the public is less opportunity for parents, families to be equipped with the notice of defect. And we are asking them to take the power during this gap year where the legislation transition, right, is going to be incumbent on community action without the resources to support that community action. So I just want to make that comment and hopefully take that back to the secretary. Did we have others who had their hands up?
Susan?
Dr. Mitchell, thank you for timely update of the form and also including the questionnaire, because that's been really a confusion. And when the previous form did not have those questions, now we have it. It's education to the parents and as well to the healthcare providers. So that's well done. And also, I really appreciate what Camille brought, the bona fide religious beliefs. This is something really thoughtful because you are putting the responsibility on the healthcare providers to verify the religious beliefs and to really sign off that form. If and when the immunization and the late forms are merged, please retain this. because the immunization form do not have that. The Division of Early Childhood Act, MSD, we processed 200,000 children's records for immunization and the lead certificates. So the immunization, like we see a lot of parents just signing off the religious exemption without the healthcare provider verification. So if and when the forms are merged, please retain this, because this is really holding the parents as well the healthcare providers responsible for what they're supposed to do. Thank you very much.
Thank you.
We have some hands up online.
Wendy, just as a follow-up, or Ruth Ann, just as a follow-up to that lag in time between the reference level and January 1st of 2024, as a private risk assessor and as a accredited training provider, I just encourage MDE. This is going to create, I think, some confusion in the private sector about what responses rental property owners are required to do. I mean, they certainly don't want to do nothing if a child in their unit has a blood lead level of 3.5. I mean, for purposes of, if they don't do anything, does that not increase their potential liability? Even though MDE says they don't have to do anything, I think we're creating not only confusion, but something that needs to be better communicated to all.
I couldn't agree more. I want to encourage people that when there is legislative action that is creating these things, to be at the table to raise this in the legislative process, because this is something that was extended after the original law was passed. This is really important about public input. I couldn't agree with you more that it creates a gap. We're going to have to remedy that gap. I've proposed one thing that we need to do with the department, but I do think there's got to be good education. And I know that we will ask the department to maybe come back next month with a plan of action or suggestions on how to address this gap. I want to, in the interest of time, we have 9 minutes, want to move on. And thank you, Susan, for raising that. I think it's quite important. We have a number of agencies here on the list. Not sure all are here, but if any have updates that you want to bring. And I'm going to ask Camille, we really do need to see the Department of Housing and Community Development at these meetings. They hold a lot of money. If there's someone here from the Baltimore City Housing and Community Development Office.
Had Catherine earlier, but I will have an offline conversation.
Okay, great. I think it's really important to talk about those resources. Didn't realize that Catherine was, I thought she was with you. She's with that other great agency, right? Same. But any agencies have other updates not previously covered?
I would briefly say we've got an influx of 8 applicants for sanitarium, which is a lot.
Wow.
We interviewed 7 and we're hiring all 7.
Wow.
But I had to fight with our food and ecology section. So because they needed 15. So we literally kind of split it down the middle. So we will be hiring new staff. But in the interim, understanding that we need to cultivate and grow our own sanitariums, because that's the only way it's going to happen. We are forging a partnership with Morgan State's Environmental Science and Food and Nutrition, and literally going to go visit those wonderful children every other semester. We're not only going to have a conversation, but we're just going to grow our own sanitariums, because that's the only way it's going to work.
Amen.
Literally.
Good deal. And love Morgan and the Morgan School of Community Health.
Yeah, let me know if you guys need help with the accreditation
I don't know
process.
any other way.
Okay, we're going to move on. You all need to talk offline and do those things. So I'm just going to run down MDE. Any other updates?
The only thing I have is that we did apply for a HUD grant to, we were invited to apply for a full application of a HUD grant for a study to evaluate lead hazards at lower blood lead levels, and we're waiting to hear from that. And that is, the funding will go specifically to salaries, nothing else.
Okay. Any other agencies have an update? Anything else from GHHI?
Ruth Ann?
Hold on, hang on.
Paul
Somebody
Rogers.
Yep.
Paul Rogers has his hand up.
Go ahead, Paul.
I just wanted to take 1 minute and talk about the ECHO program. Really appreciate the commission's help in partnering with us. And the good news is we're not asking any money at all. It's no money from the commission. With the Maryland chapter, American Academy of Pediatrics, ECHO program is in place now. And our goal is to work with 17 pediatric practices. And we're working with them and see how we can improve testing, how we can improve follow-up, how we can improve education and counseling of families. And this will last 9 months. This program goes through April, and I'll be sharing the information that we achieve from this special study.
Are you
That's
still,
it. Thank you.
Are you still looking for practices to participate?
Yes, it is still possible to join in, and if somebody is interested, let me know. I can send the flyer.
Great. So if anybody has a good pediatrician to recommend, it'd be great. So outside of the agencies, before we get to GHHI, anybody in the audience has any announcements, anything you'd like to share? Okay. GHHI, anything else that we missed? Thank you. So I just want to say thanks, everybody. This has been highly awkward because of the technology. My hands are really tired from holding the phone. And sorry to the commission that we seem to have our back to you. But there was a point in this, and the point was to connect what this is all about. Kids, their families, and community. I am going to urge every commission under our next governor after the election. We'll know who that is, but that commissions need to be in the public. They need to be accessible. They need to be attainable. I also want to say to our public members here and online that we still have open positions for parent of a lead poisoned child and a number of other positions that we are seeking from community input. This table needs to grow and change, and we want to invite that. But I want to thank everybody who has taken the time to come together as human beings. Those who are still virtual, we look forward to seeing you. We respect everybody's choices in this environment. But I have to say, the joy of the kids today getting greeted by Derek the dinosaur when they came in was a sight to see. I want to thank my own team who hustled to put this together. And thank you for putting up with the awkwardness. We know that one thing we need to do is do a bigger test on technology and ensure that we have better broadband to our schools. With that, we will sign off and say thank you. Congratulations, Wendy, Barbara, and Wes for your service. Keep going, and everyone else too.